Wow, I just learned about brain structure abnormalities. It's crazy how these differences can affect how we think, feel, and behave. Sometimes they're linked to mental health issues or neurological conditions. Scientists are still uncovering how these abnormalities develop and how to treat them. Understanding this gives me a new perspective on brain health and mental wellness. If you're curious about how your brain works, check out the latest research. Knowledge is power, especially when it comes to our brains. Click the link to learn more about brain structure abnormalities and what they mean for you. Genetic seizures can feel like a storm brewing in the brain, triggered by specific genetic mutations. These seizures aren't just random. They can be linked to conditions like epilepsy, where faulty genes disrupt normal brain activity. Imagine your neurons misfiring like a faulty circuit. Understanding these genetic factors is crucial for effective treatment. With advancements in gene therapy, we're getting closer to targeted solutions that could change lives. It's a fascinating intersection of genetics and neurology, revealing how our DNA shapes our health in ways we're just beginning to comprehend.
Head trauma can lead to seizures, and it's more common than you might think. When the brain experiences a jolt, it can disrupt electrical activity, triggering seizures. These can happen immediately or even days later. It's crucial to recognize the signs like convulsions or unusual behavior, because timely medical attention can make all the difference. If someone has a seizure after a head injury, don't panic. Keep them safe, clear the area, and seek help. Understanding this connection can save lives and improve outcomes for those affected.
Epilepsy is a neurological disorder that affects the brain. It causes recurrent, unprovoked seizures, which are sudden surges of electrical activity. These seizures can vary from brief and nearly undetectable to long periods of vigorous shaking. Epilepsy can affect anyone, regardless of age or gender. Managing epilepsy often involves medication, lifestyle changes, and sometimes surgery. It's important to raise awareness and support those living with epilepsy. Understanding epilepsy helps break the stigma and fosters a supportive community. Recurring seizures, also known as epilepsy, are episodes of abnormal brain activity that can cause a range of symptoms, from convulsions to loss of awareness. Imagine your brain suddenly firing off signals like a faulty circuit. This can lead to unpredictable moments that disrupt daily life. Each seizure can vary in intensity and duration, and they can be triggered by stress, lack of sleep, or flashing lights. Living with this condition means navigating a world where awareness and support are crucial. Treatment often involves medication, lifestyle changes, and sometimes surgery. Understanding seizures is key to breaking the stigma and fostering empathy for those affected. Ever wonder what abnormal electrical activity is? It's when your brain sends unexpected signals, causing a disruption. Think of it like a sudden power surge in your home. It can lead to seizures or other neurological symptoms. Understanding it is key to managing conditions like epilepsy. So, next time you hear about it, you'll know it's all about those brain waves. Stay informed and take control of your health.
Generalized seizures are a type of seizure that affects both sides of the brain simultaneously. Imagine a sudden electrical storm in your brain, causing widespread disruption. There are different types, like tonic-clonic seizures, where you might experience intense muscle contractions and loss of consciousness. Then there are absence seizures, which can make you zone out for a few seconds, almost like a brief daydream. These seizures can be triggered by various factors, including stress, lack of sleep, or flashing lights. Understanding generalized seizures is crucial for managing them effectively and supporting those who experience them. Knowledge is power, especially when it comes to brain health.
Focal seizures, also known as partial seizures, occur when abnormal electrical activity is localized in one area of the brain. They can manifest in various ways, from twitching a finger to experiencing intense emotions or even hallucinations. What's fascinating is that during a focal seizure, a person may remain aware of their surroundings, unlike in generalized seizures. These episodes can last anywhere from a few seconds to a couple of minutes. Understanding focal seizures is crucial for effective management and treatment, as they can significantly impact daily life. Recognizing the signs can help those affected seek the right support and care. Infectious seizures, often linked to infections like meningitis or encephalitis, can be a startling experience. Imagine your brain under attack, where inflammation disrupts normal function. These seizures aren't just random, they're your body's way of reacting to a serious threat. Symptoms can vary from convulsions to unusual sensations, and they require immediate medical attention. Treatment often involves addressing the underlying infection and managing the seizures. Understanding this connection is crucial because when your brain is fighting off an infection, it can lead to some unexpected and alarming symptoms. Stay informed, stay safe.
After a seizure, the aftermath can be a wild ride. I often feel this overwhelming fatigue, like I just ran a marathon in my mind. My muscles can feel weak, and sometimes I have this strange confusion, as if I'm waking up from a deep sleep. It's not just physical. Emotions can swing wildly too. I might feel anxious or even a bit depressed. And then there's the memory fog. Trying to piece together what just happened can be frustrating. It's a reminder that the brain is a complex puzzle, and every piece matters. Understanding these symptoms helps me navigate the recovery process and take care of myself better. Managing seizures can be overwhelming, but knowing your medication is key. Always take your medication exactly as prescribed by your doctor. Consistency is crucial. Don't skip doses or change your schedule. Stay informed about your medication's effects and side effects. And remember, always consult your healthcare provider for any concerns.
Surgery for seizures can be a life-changing option for those who don't respond to medication. Imagine living with unpredictable seizures, feeling trapped in your own body. For some, surgical intervention offers hope. The most common procedure is called a lobectomy, where the part of the brain causing seizures is removed. It's not for everyone, but studies show that about 60% of patients experience significant improvement or even become seizure-free. The process involves thorough testing, including brain scans and monitoring, to pinpoint the exact source of the seizures. While surgery carries risks, for many, the potential rewards, regaining control and improving quality of life, are worth it.
Seizurile nu sunt doar momente de criză, ci și o parte din viața mea. De multe ori mă simt ca un artist pe o scenă, dar fără control asupra spectacolului. Viața mea se împarte între momente de normalitate și acele clipe imprevizibile. Am învățat să-mi planific zilele cu atenție, să evit stresul și să am întotdeauna un plan de urgență. Prietenii mei au devenit aliați, mereu pregătiți să mă ajute. E important să vorbim despre asta, să spargem stigmatul și să arătăm că, deși trăim cu această provocare, putem avea o viață plină de bucurii și realizări.
Managing seizures can feel overwhelming, but knowing what to do makes a huge difference. First, stay calm and ensure the person is safe. Move any sharp objects away. Timing is crucial. If a seizure lasts more than 5 minutes, call for help. After it ends, gently roll them onto their side to keep their airway clear. It's also important to reassure them, as confusion is common afterward. Keeping a seizure diary can help track triggers and patterns, making it easier to discuss with a healthcare provider. Remember, knowledge is power. Being prepared can turn a scary situation into a manageable one.
Seizures kunnen overweldigend zijn, zowel voor de persoon die het meemaakt als voor de mensen om hen heen. Het is cruciaal om te weten hoe je kunt helpen. Blijf kalm en zorg ervoor dat de omgeving veilig is. Verplaats geen objecten die gevaarlijk kunnen zijn. Leg de persoon op hun zij om verstikking te voorkomen en let op de tijd. Als de aanval langer dan 5 minuten duurt, bel dan een ambulance. Na de aanval is het belangrijk om geruststelling te bieden. Een simpele aanraking of een vriendelijk woord kan veel betekenen. Samen kunnen we de angst rond epilepsie verminderen en een ondersteunende omgeving creëren.